group, this is what we see as some of the challenges of improving youth mental health. However, we appreciate that you may see things differently. Our deprivation statistics are significantly higher than North West averages. We are one of the furthest constituencies from Westminster, and decision makers aren't aware of our particular challenges. Compared to most other areas, we have less available public and third sector mental health support, health services, public transport, social mobility, jobs and training opportunities. All of this, with rural isolation, adds to mental health problems. It is a real struggle for us to get statistics about anything to do with youth mental health and funding. So it's really difficult for us to know what is going on, which adds to a sense of mistrust in the community.
Please can you help us to make more information public available about what investment and spend there is on youth mental health?
The impact of having to wait up to 15 months specialist mental health services is having a devastating effect on young people, their families, friends and schools. The whole system feels overstretched and is affecting everyone's mental health. Between the ages of 16 and 18 years of age, young people are under huge academic pressure. This is the same age when many of our most vulnerable young people fall into a gap of mental, physical and social services. Many are told that they are too old for children's services and are too young for adult services and will have to go back on a waiting list. Most young people say that they get worse, not better, when they are on a waiting list, as they don't know how long it will be. They don't know how long they will be waiting. They feel like they are brave to ask for help, but then feel dumped, unvalued and unimportant. There is a lot of negative media on youth mental health services in Cumbria. Most people have the perception that our youth mental health service is broken. Young people say that the quality of provision of youth mental health provision is very mixed. There are recruitment challenges for youth mental health posts, and very few schools have access to any school counsellor.
Can you help us to find out how many counselling hours schools currently have available?
The number of young people meeting the criteria for specialist mental health support quadrupled in West Cumbria last year. You may not agree or like it, but most people perceive this as a youth mental health crisis in West Cumbria.
Right, so I'm Jazz. I'm going to speak about some of the opportunities which we think we have. So challenges also create opportunities. We see the following as opportunities to improve youth mental health. Everyone is on the same page: schools, health professionals, parents, community leaders, decision makers and young people. Everyone we speak to sees improving youth mental health as a priority. We have a signed letter of support from Stephen Eames, a North Cumbria Integrated Care System Lead, Catherine Fairclough, Chief Executive of Cumbria County Council, John Lawler, Chief Executive of Northumberland Tyne and Wear NHS Foundation Trust, and Peter Rooney, Acting Accountable Officer of NHS North Cumbria CCG. We also have offers of support from Sue Heyman, a local MP, Barbara Keeley, Shadow Minister for Mental Health, Jackie Doyle-Price, Minister for Mental Health, and Catherine Tyack, Head of Mental Health Prevention at the Department of Health. We will have strong partnerships with schools, communities, young people and health groups. The newly formed West Cumbria Mental Health Network strengthens partnerships and communication.
If you want to make contact with the new West Cumbria Mental Health Network, please speak to Councillor Rebecca Hanson.
We have proven that involving young people and communities in addressing youth mental health problems works and actually improves people's mental health. If each school had its own pupil-led mental health group that looked at what they could do to improve mental health in their school and community, it would give those young people involved skills, responsibility and purpose. Create the right solutions. Young people are best placed to look at what and how we can improve things in our schools. Reduce the pressure on teachers, and teachers are under loads of pressure as we all know. Create an infrastructure of informed and active young people across our schools. It would be a world first. And in our school, so I'm from Cottonmouth School, we've tried to do this. We've created our own kind of youth mental health group at school, and it's had a massive impact. We've seen it have a massive impact. So we think if like lots of other schools in Cumbria could do this, like imagine what the impact would be, and we need to kind of almost create a network between the schools to improve like this and try and tackle this crisis. Sorry about that. The government has this year committed an extra £2.3 billion to mental health. The NHS long-term plan, which has been mostly well received by the NHS long-term plan, has been mostly received by youth and mental health professionals. And CAMS has been taken, so CAMS West Cumbria is being taken over by Northumberland Tyne and Wear NHS Foundation Trust. And this will bring with it new ways of working with a stronger infrastructure and more clinical capacity. So in summary, we think we could do the biggest turnaround job on record for youth mental health services in the UK. We could initiate a whole community response to a whole community problem. And we have visionary, creative thinkers within healthcare, the community and education. So it must be possible to have the very best youth and mental health here in West Cumbria.
As we have heard, there are both challenges and opportunities. I'd like to balance these out and talk about what we see as the reality of the situation. Whilst we have talked about the opportunities to transform youth mental health, the whole system, including you and us, are overstretched. Whilst we welcome a national increase in £2.3 billion for mental health, we have no confidence that this investment will make an urgent difference to young people in our area. Whilst the new NHS long-term youth mental health plans are welcome, the timescale for rolling out the pilots is not clear and looks to be very slow. The pilots are planned to only reach 1/5 of the country. We have been told that the most likely successful applicants will be based near an NHS training centre. Our nearest is Manchester. It is also a very competitive process. Whilst we and many others are flat out delivering some fantastic on-the-ground youth mental health initiatives, they won't make enough difference because the system is bunged up if you can't refer people quickly to specialist services. Whilst it is fantastic that adults in crisis are contacted within 4 hours, it is not good enough for young people in crisis to be seen within 48 hours. As one of our other members said, you don't leave someone in a burning building for 48 hours. A crisis is a crisis. Whilst it is fantastic that many adults are seen by First Steps mental health services within 6 weeks, we know young people who have been waiting over a year for CAMS and My Time services. Whilst it is fantastic news that CAMS in West Cumbria say that they have reduced the number of young people waiting for specialist mental health support from just under 300 in February to approximately 40, we have real concerns that this is not because many people are now receiving help, but instead many people have been referred elsewhere or rejected. We would like to have confidence in the quality of the assessment process. While 75% of mental health conditions arise before the age of 18 years of age, only 10% of the North Cumbria CCG mental health only 10% of the North Cumbria CCG mental health spend is on young people. It makes no sense. Whilst we are delighted to see so many people like yourselves passionately care about youth mental health and are making a difference, there is no overall leadership person or body for youth mental health. Whilst we all want to do something about all of this, unless we urgently do something transformative, we will have a public health crisis on our hands. Are we laying the seeds for an epidemic of chronic health conditions?
We demand that young people and their mental health is taken seriously, and that improving young people's mental health is seen as an urgent public health priority. We want these following targets to be committed to: 4-week waiting times for specialist youth mental health services, including CAMS and My Time. A young person in crisis to be seen within 4 hours. A mental health specialist available for all schools. Youth mental health services available for young people up to 25 years of age. We want these targets adopted by the whole community of West Cumbria and to have ambitious timescales. We want to be innovative in how the whole community helps achieve this. We want the quality of youth mental health services to be outstanding. We want leadership to get the whole system working. We want transparency and accountability for for our youth mental health services. We want to settle for nothing less.
So, how do we actually realistically do this? Well, first off, we'd just like to say thank you to everyone working their hardest to improve youth mental health, in the area. We know you're all working incredibly hard and it's a challenging issue, so we thank you for that. And we also thank you just for inviting us today, because, it's so good to have young people as part of the discussion, and the more voices you have at the table, it stands to reason that, the better discussions you can have. So thank you for that. Secondly, we want you to know that none of this is intended as criticism. So we know you're doing your best in very challenging circumstances. We want to work with you. Thirdly, for all of you who are doing everything we can to improve youth mental health, it is essential that we don't burn out. We've got to protect our own mental health as well. And that's important for a lot of staff in CAMS and other services who are very overstretched. So we need to support them. So what do we think is the best way to move forwards? We need to see improving youth mental health as a health priority and as everyone's responsibility. We need to bring together a community of people who want to improve youth mental health. And this community needs to get behind the same vision with the same targets. We all need to know what is our bit. What are we doing each day to contribute to achieving these targets? We need to do this brilliantly and together. So how do we do this? How do we build a community of people who want to improve youth mental health in our area? Whether it's a hairdresser in Maryport or a teacher in Whitehaven or Stephen Eames, we all, each of us, need to sign up and put our names to this campaign, because, it's a lot easier to get behind a campaign than an issue. We need to come together with the same shared vision. We'd like to suggest having the courage to talk, have the courage to listen, and no one is alone. If you can get that phrase out there as much as possible, it will really help shift perceptions. It's a talking point. It works well. It's worked well for us, anyhow. It's a clear message, and it's been written by young people and service users. We need to come together with the same targets. So as Reece proposed, can we please all aim to meet those 4 4s? Because it would need the whole community to work together to make it happen. We can help you lobby for more investment. CAMS is being redesigned. It's almost a clean slate having this Northumberland Tyne and Wear taking over. We see that as a good opportunity to think of some innovative new ideas. Schools are working together and sharing best practice. Youth mental health first aid is still being rolled out, but needs to be rolled out even more. We want to make more films as well to help challenge perceptions. So, with your help, everyone working together, we really think we can make this happen. Demi, do you want to?
Our real message is have the courage to talk, have the courage to listen, no one is alone. We recognise that to put in place the changes needed for youth mental health, we urgently need courage, leadership and action. Please help us. Thank you so much for listening.